Next question based topic is on heart sounds. First heart sound, it is low, slightly prolonged lub, and it is caused by vibrations due to closure of mitral and tricuspid valves, and it is the loudest and longest of all heart sounds. Coming to second heart sound, it is shorter, high pitched dub sound caused by vibrations due to closure of aortic and pulmonary valves just after the end of ventricular systole. It has higher frequency, shorter duration and low intensity. And coming to third heart sound, it is heard about 1/3 of the way through diastole, and it coincides with the period of rapid ventricular filling. Whereas fourth heart sound, it occurs due to ventricular filling and is rarely heard in normal patients. Coming to the question, first heart sound caused by, the answer is both mitral and tricuspid valve closure.